Secureport IV is single patient use and comes in packaging that is sterile inside. Open the vial packet and drop onto your sterile field. To activate the Secureport IV, press down firmly on a hard surface. Invert the vial and watch the glue run into the applicator section. Squeeze gently on the ridge section and you'll see a small droplet of glue appear. Apply steady, gentle pressure at the insertion site, ensuring that hemostasis is achieved. The insertion site must be clean and dry prior to application. Observe the site for bleeding for 5 seconds. If bleeding commences, then apply pressure again until the bleeding has stopped. Apply 1 small drop of Secureport IV at the insertion site. Less is more when applying this product. Always wick away the excess with a piece of sterile gauze. This will ensure that the product immediately dries. If the fluid does not run circumferentially around the line, then apply an additional drop of Secureport IV, again wicking away the excess immediately to ensure the product dries quickly. Apply 1 to 2 drops of Secureport IV underneath where the steri strip will be applied. Using the side of the applicator, spread the product into a very thin layer. The thinner the layer, the quicker the product will dry. Once the product is dried, then apply a single steri strip, ensuring that you do not stretch the steri strip. Coil the line. Once coiled, apply a steri strip to the coil to ensure that it does not unravel. Do not apply the steri strip to the skin at this point. Apply Secureport IV on the patient's skin and again use the side of the applicator to spread into a very thin layer. You must ensure that everywhere that the dressing will adhere to is covered in a thin layer of the product. This will allow the dressing to adhere to the product as opposed to adhering to the patient's skin, and will also ensure that the dressing does not lift. Wait a few seconds for the product to dry and then apply the coil to the patient's skin. Secure the butterfly hub, ensuring that gauze is placed underneath the hub to protect the patient's skin. Apply clear film dressing, ensuring that the dressing is not stretched. Perform X-ray or ultrasound. If line needs to be repositioned, use a peel to loosen the steri strip. Apply a gentle pressure to the steri strip to ensure that the appeal has broken the glue bond. If there is resistance when trying to draw back the line, then apply the appeal pad over the insertion site for a few seconds. You can then reposition the line. Ensure that the site is clean and dry before applying another drop of Secureport IV at the catheter skin junction. Again, dabbing away the excess after each drop. Again, apply a small drop of Secureport IV on either side of the catheter where the Steri-strip will go. Ensure that you spread out the product into a thin layer wherever the dressing will be adhering. If you fail to spread the product underneath the dressing will curl and will need replacing. Apply Steri-strip and clear film dressing. The dressing can stay in place for as long as the site is clean, dry and intact. The glue bond will last for approximately 5 to 7 days. If removal of the line or dressing is required within this time period, then ensure that a peel is used